If you have Medicare, and this includes both Original Medicare and Medicare Advantage health plans, you have rights. KeyPro is the Beneficiary and Family-Centered Care Quality Improvement Organization, also known as a BFCCQIO, for the 29 states that are highlighted on this map. KeyPro helps people with Medicare file complaints about quality of healthcare services and make requests to appeal a hospital discharge or stopping of skilled services such as physical therapy. We also offer immediate advocacy services when issues need to be taken care of right away. This video goes over how to file an appeal. Here are some examples of when you may want to call KeyPro to make an appeal. I was admitted to the hospital. I was told that I would be discharged, but I don't feel I'm ready to go home. Can I stay in the hospital? And will Medicare continue to pay for it? I have been getting physical therapy visits from a home health agency. On my last visit, the therapist told me my services would be ending, but I feel like I still need physical therapy. How can I continue to get these services? Will Medicare pay for it? There are two different types of appeals: hospital discharge appeals and skilled service termination appeals. Let's take a closer look at each one. The first type of appeal is called a hospital discharge appeal. What happens if you are a patient in the hospital and you are being sent home, but you feel you aren't ready to leave yet? You can call KeyPro and ask to appeal or stop the discharge. In order to appeal your discharge, you must be an inpatient. There is no official way to appeal your discharge if you are in observation or outpatient status. Be sure to ask your doctor what status you are in. At the time of your admission, and again before discharge, the hospital staff must give you a form called an important message from Medicare. This form includes the phone number for KeyPro and tells you what you need to do to appeal the discharge. If the hospital staff did not give you this form, please ask for it. By law, the hospital must give you this information. If you call KeyPro for an appeal, an independent physician reviewer will look at your medical record to see if you should stay in the hospital. If you are not able to call KeyPro yourself, you can ask someone, such as a family member or friend, to call for you. While you are in the hospital and KeyPro is reviewing your appeal, you do not have to leave the hospital. And if you have made a timely request for an appeal, Medicare will continue to cover your care during the review. Within 1 calendar day after KeyPro gets all the information needed, you will get a phone call to let you know if Medicare will continue to pay for your stay in the hospital. You will also get a letter in the mail. If KeyPro agrees with you about your appeal and you stay in the hospital, you will get another important message from Medicare with a new discharge date. When you get this form, you will need to do another appeal if you are not ready to leave the hospital by the new discharge date. If KeyPro disagrees with the appeal and you still don't feel ready to leave the hospital, there is something you can do. When you get the phone call, the nurse will give you information about something called a reconsideration review. This is when another independent physician reviewer looks at your medical record and the appeal. You can tell the nurse you want a reconsideration review while you are on the phone, or call in later when you decide. During the reconsideration review, Medicare may not continue to cover your hospital stay if the second physician reviewer agrees with the original decision. The next type of appeal is called a skilled service termination appeal. If you have Medicare, you have the right to appeal if you do not agree with the decision that your skilled services will be stopped. What are skilled services? Let's take a look at a few examples. Getting a visit from a nurse at a home health agency, receiving hospice services, and getting physical therapy. When your skilled services are ending, staff must give you a form called a Notice of Medicare Non-Coverage. This notice shows you the date of when your skilled services will end, which is called the effective date. The notice will also tell you how to appeal and the phone number to call KeyPro. Once you get the notice, you can call KeyPro. KeyPro will help you to file an appeal. If you are not able to call KeyPro yourself, you can ask someone else, such as a family member or friend, to call for you. An independent physician reviewer will look at your medical record to see if the services should continue. You will get a phone call about the results of the review, letting you know if Medicare will continue to cover your skilled services. If you don't agree with KeyPro's decision, there is something that you can do. When you get the phone call, you can ask for something called a reconsideration review. This is when another independent physician reviewer will look at your medical record and appeal. During a reconsideration review, Medicare may not cover your skilled services if the second physician reviewer agrees with the original decision. For more information about KeyPro services for people who have Medicare, visit our website at www.keproqio.com/services. If you want to file an appeal, or if you have any questions about KeyPro, please call us. Our phone numbers are on our website at www.keproqio.com.